Lymphoma, types, causes and treatment. Lymphoma is a cancer of the lymphatic system. It affects a type of white blood cells known as lymphocytes. This help fight disease in the body. They play an important role in the immune system. As lymphoma is present in the bloodstream, it can spread or metastasize to different parts of the body. Lymphoma can occur at any age but is one of the most common causes of cancer in children and young adults aged 15 to 24 years. It is often treatable. In the United States, the lifetime risk of getting non-Hodgkin lymphoma is 2.1%. The risk of getting Hodgkin lymphoma is around 0.2%. Here are some key points about lymphoma. Lymphoma is a cancer of the lymph nodes and lymphatic system. The two main types are Hodgkin and non-Hodgkin. Non-Hodgkin is the most common. The main symptom is usually an enlargement of lymph nodes that does not go away as it normally would after infection. There is no way to prevent lymphoma, but survival rates after treatment are good. What is lymphoma? Cancer happens when there is uncontrolled growth of abnormal cells that thrive and spread instead of dying as they would in the life cycle of a normal cell. Lymphoma is a cancer that starts in the white blood cells or lymphocytes. Lymphatic cancers are classified by the type of immune cells affected. The two main types are Hodgkin and non-Hodgkin. Within this, there are many subtypes. Non-Hodgkin, the most common type, affects B and T cells. It accounts for 90% of lymphoma cases and around 4% of all cancers in the US. Classic Hodgkin lymphoma is marked by the presence of cells known as Reed-Sternberg cells. Other subtypes affect different types of cells. Hodgkin can occur at any age, but it is most common in children and adults under 25 years. It affects men more than women. In most cases, it is curable, but treatment and prognosis symptoms. The signs and symptoms of lymphoma are similar to those of illnesses such as viral diseases and the common cold, but they continue for longer than would normally be expected. Some people will have no symptoms, but some may notice a swelling of the lymph nodes. These are located all around the body, often in the neck, groin, abdomen, or armpits. The swellings are normally painless, but pain may occur if the enlarged glands press on organs, bones, and other structures. This can be confused with back pain. Lymph nodes can swell during common infections such as a cold, but in lymphoma the swelling does not go away. Pain is also more likely to accompany with the swelling if it is due to an infection. The overlap of symptoms can lead to misdiagnosis. Anyone who has ongoing swelling of the glands should see their doctor. Other symptoms of both types of lymphoma may include ongoing fever without infection, night sweats, fever and chills, weight loss and loss of appetite, unusual itching, persistent fatigue, unusual tiredness and lack of energy, pain in lymph nodes after drinking alcohol. Additional symptoms that can indicate non-Hodgkin lymphoma include persistent coughing, shortness of breath, pain or swelling of the abdomen. Pain, weakness, paralysis or otherwise altered sensation can occur if an enlarged lymph node presses against spinal nerves or the spinal cord. Lymphoma can spread rapidly from the lymph nodes to other parts of the body through the lymphatic system. As cancerous lymphocytes spread into other tissues, the body's ability to fight infection weakens. Causes and risk factors. Exactly what causes lymphoma is unclear, but there are some risk factors. Non-Hodgkin lymphoma. Risk factors for non-Hodgkin lymphoma include age. Most lymphomas occur in people aged 60 years and older, but some types are more likely to affect children and young adults. Sex. Some types are more likely in women and other are more likely in men. Ethnicity and location. In the US, African Americans and Asian Americans are at lower risk of non-Hodgkin lymphoma than white Americans, and it is more common in developed nations. Chemicals and radiations. Nuclear radiation and some chemicals used in agriculture have been linked to non-Hodgkin lymphoma. Immunodeficiency. A person with a weak immune system is more at risk. This can be due, for example, to HIV or AIDS medications taken after an organ transplant. Autoimmune disease. This is when the immune system attacks the body's own cells. Examples include rheumatoid arthritis and celiac disease. Infection. Certain viral and bacterial infections that transform lymphocytes increase the risk. Breast implants. This can cause anaplastic large cell lymphoma in the breast tissue. Body weight and the diet. Obesity has been implicated in the development of lymphoma, although more research is needed to confirm the link. Hodgkin lymphoma. Risk factors for Hodgkin lymphoma include infectious mononucleosis. Infection with EBV can cause mononucleosis, which increases the risk of lymphoma. Age. People between the ages of 20 and 30 years and people over the age of 55 years have a higher risk. Sex. It is slightly more common in men. Location. Hodgkin lymphoma is most common in the US, Canada and Northern Europe. It is least common in Asia. Family. If a sibling has the condition, the risk is slightly higher, and very high if the sibling is an identical twin. Affluence. People from higher socioeconomic status are at greater risk. HIV infection. This can weaken the immune system and increase the risk of lymphoma. Treatment and outlook. Treatment depends on the type of lymphoma and the stage it has reached. Indolent or slow growing lymphoma may need only watchful waiting and no treatment. If treatment is necessary, it can involve biologic therapy. This is a drug treatment that stimulates the immune system to attack the cancer cells by inserting living microorganisms into the body. Antibody therapy. Synthetic antibodies are inserted into the bloodstream to combat the cancer's antigens. Chemotherapy. Aggressive drug treatment is used to kill cancer cells. Radioimmunotherapy. This is on small areas of the cancer. Stem cell transplantation. This can restore damaged bone marrow following high dose chemotherapy or radiation therapy. Steroids. This may be injected to treat lymphoma. Surgery. This can be used to remove the spleen or other organs after the lymphoma has spread. Surgery is used more often for obtaining a biopsy. With treatment, more than 2 in 3 people diagnosed with stage 1 non-Hodgkin lymphoma will survive for at least 5 years. With stage 1 Hodgkin lymphoma, just over 85% of people who receive treatment will survive for at least 5 years. It is important to seek medical attention for unusual signs and symptoms, as this can lead to an early diagnosis and a good chance of successful treatment.